Hi everyone, my name is Dr. Deepak P. Mohanan and I am working in NMC Medical Center, Maysaloon. I have more than 10 to 15 years of experience in the field of gastroenterology, and my areas of special interest are the fatty liver and cancers in gastroenterology. Today, our topic of discussion will be the cancers in gastroenterology. Gastroenterology is associated with plenty of cancers, primarily starting from the GI lumen. Cancers of the food pipe, or what we call the esophageal cancers, stomach cancers, colon cancers, and cancers of the liver, biliary system, and pancreatic cancers. In the Western countries, more of the colon cancers are predominant, while in the Asian, we see more of esophageal cancers. Today, the cancer incidences are increasing due to various factors, including our lifestyle. We see a rise in cancers primarily due to one change in the lifestyle, to the change in the food habits, increase in the smoking, consumption of alcohols. Of course, there is the influence of fast food, and definitely we know that detection techniques for cancers are also improving year by year. Number of cancers we pick are much more than what it used to be 10 to 20 years earlier. GI cancers can be screened in various ways. Usually, we look at the risk factors, including the genetic, hereditary, and social factors. So if there is a higher risk, then for each cancers we have certain primarily some tumor markers. Like for the liver we have something called alpha-fetoprotein. For the colon we have CEA. For the pancreas we have CA99. And simple tools like ultrasound abdomen can help in screening GI cancers. Each GI cancer presents with a different set of signs and symptoms. If the cancers of the food pipe, we have difficulty in swallowing. The cancers of stomach present with abdominal pain, and same is with the pancreatic cancers. Cancers of the colon present with rectal bleeds or change in the bowel habits. Cancers of the liver present with jaundice, and the same is also with the biliary cancers. Endoscopy has a very great role in detection, confirmation, and staging of GI cancers. In most forms, like the primary for any esophageal cancer, the first diagnostic modality will be an endoscopy, locating the lesion, taking samples from it. It is all the same for the stomach cancers and the colon cancers. For the colon, we do a colonoscopy. For the stomach and the esophagus, we do a gastroscopy. Today, with the advance in endoscopy, we also have advanced techniques like endoscopic ultrasound, which can be used to detect cancers of the pancreas and also to take biopsies from the pancreatic cancers and the biliary cancers. Today, not only endoscopy is used for diagnosing, but it is also used for collecting the samples, staging, and sometimes treatment. Early GI cancers of mainly the mucosal lining from the food pipe, the stomach or colon, which has not gone deeper, can be removed by endoscopy itself. In any cancers, the role of early detection, we know that earlier we detect, the chance of recovery and ease of treatment are definitely better. The same goes with the GI cancers, because most of the GI cancers, when we detect in the stage 1, which has not gone deeper, we can treat it with simple endoscopic techniques. The ones which has gone deeper, maybe up to the stage 2, can be treated only with surgical means. So cancers which has gone further into stage 3 or 4 requires a whole dedicated team of surgical oncologists, medical oncologists, radiation therapists, and gastroenterologists. Here, primarily, we may have to start with chemotherapies or radiations, and which are followed by surgeries. So once we detect them in the early stages, they can be completely cured without any harmful effects of chemotherapy or radiation. And hence, in today's world, whenever the patient is at high risk factors or there is a chance of having a GI symptom which stands for longer duration, we always go for early endoscopy to detect the conditions at its earliest stage. Gastrointestinal cancers survivability depends on at which area the cancers are detected. Cancers of the pancreas has a poor prognosis where the treatment and the outcomes are not really great. But for the colon cancers, for the stomach cancers, provided we detect at the earlier stages, we have good survivability rates with good treatment modalities available. The key to treatment is its early detection and timely treatment. The take-home message is most of the gastrointestinal cancers are essentially modifiable or in other simple terms preventable, because to great extent they are contributed by either lifestyle, dietary habits, other habits like smoking, alcohol, etc. So most of these things can be modified by healthier choices, and hence most of these GI cancers can be prevented except when they are of genetic or inherited nature. So a healthy lifestyle can go a long way in preventing GI cancers. That will be our take home message. Thank you everyone for listening to me on my talk on gastrointestinal cancers. I think I was able to convey a simple message of healthier choices in my today's message. I am available at NMC Medical Center Maysaloon on all days